Health impact assessments are a fairly new public health tool that are being utilized throughout the country, and really more on the coastlines. So the Midwest they're new to the Midwest, they're not used that often. And they're a tool that allow communities to look at programs, policies, initiatives, and see what the health impacts of those things will be prior to implementing them.
Columbia, the health department has been involved with their own health impact assessment regarding future transit options. And so we've come in to help the rest of the community understand why health impact assessment could be relevant to Columbia now and how they might use it in their own jobs going forward, whether it's the school department or the city government, county government, and some of the private funders in the area as well, so that they can understand just what it means to them and why in the future they might have something that they're thinking of doing that would justify thinking about the health impacts of it.
Currently doing our pilot HIA on the public transit system. There's been a lot of talk over the past probably 18 months to 2 years about the transit system in Columbia. And so we decided that doing an HIA on the potential expansion of that system would allow us to gather information and give information to the policymakers who may be making decisions that would affect the transit system here in Columbia.
Health impact assessment is a standard procedure to figure out what the potential health impacts of something that's been proposed could be. So it could be a plan, a new program, a new policy at any level of government or with a private entity. And also to figure out what the way to mitigate the impacts could be if they're negative, or if there's potential positive health benefits, to find out how to accentuate those or make sure they're provided to everyone who's going to be affected by it.
Health impact assessment is a growing field. There used to be maybe 30 health impact assessments that had been completed in the U.S. Recently, the interest has grown. There's almost 200 health impact assessments that have been completed just within the last three or 4 years. So people are really starting to get interested. They're excited about how it can be applied in their own communities, and we're excited to help share that information with others.
So we have 2 grants. One is from the Robert Wood Johnson Foundation, one is from the Missouri Foundation for Health. And those grants are to allow us to pilot HIAs within our community because we've never done those here. For us to gain experience in implementing HIAs, and then also allow us to look at how we might be able to sustain those within our communities.
So some of the other examples that I've worked on were in Atlanta. And one of the ones I looked at was an old industrial site, which we call brownfields, because it could have contaminated property there. But the biggest issue with it was that it had been abandoned and wasn't going to be used for anything. And a private developer wanted to come along and put hotels and a conference center. It was near the airport, and stores and offices. And it was located in a relatively small city of just 6,000 people. So it was going to really massively increase the people who worked there and visited there. And so looked at the health impact of that, and the developer was very interested in it because he also wanted to make sure that the city residents were welcoming of the development.
And we ended up recommending that they zone it to allow things like community gardens and farmers markets as a way for the people in the neighboring communities to have access to fresh fruits and vegetables because they didn't have any grocery stores nearby, didn't have access to some healthy food that way. We suggested that they zone it to allow people to use the existing buildings on the property so they could have community meetings and just keep connecting with each other, get to know each other that way. And we also suggested that they could zone it to limit the number of fast food restaurants in the area. There's already a lot of fast food restaurants. People really need to have access to some healthy options as well as the existing community businesses. And so all of those recommendations were offered as a way of the redevelopment process for this Army base that's closing in Atlanta.
So we know that policies in all different domains like transportation or education, even if they don't explicitly discuss health or address health, that they have effects on health. So what health impact assessment allows decision makers to do is to have information about how what they're proposing could influence health in time to sort of make adjustments to that policy. So the goal of health impact assessment is to provide information with the aim of improving policy so that any negative health effects are mitigated and any positive effects are promoted. As part of the grant that we have from Robert Wood Johnson and from Missouri Foundation for Health, the two grants, we have brought in 2 experts on health impact assessment from the Georgia Health Policy Center to lead a half-day workshop on conducting health impact assessment and on how this tool can be applied in Columbia and Boone County. And we have a pretty incredible group of people from across city and county government, community organizations, business organizations who are coming to hear how health impact assessment, what it is, first of all, because many of them have not yet been familiar with it, and then how it can be used in their work and how we might continue to apply health impact assessment in Columbia and Boone County. Health impact assessment is something that's much more common in Europe. It's been around for a decade or more, and in some countries there, like in England or United Kingdom, it's something that's done regularly. If there's a big policy or program that's being planned, then it's required that they consider how is this going to affect health before they put it into place. Here in the U.S., it's less common. There have been 200 now in the United States, and most of those have been concentrated on the coasts. So there are a lot that have been done in California and Oregon, some on the East Coast and some in the Southeast. That's where our HIA experts come from Georgia. But really, there's a big gap in the Midwest, and especially in small communities. So the idea came through our grant holding partners, PedNet and Central Missouri Community Action, that they learned of this tool and they thought it's something that's not being discussed here, it's something that hasn't been applied here, and they wanted to look into how health impact assessment could be used.
A couple of things that were brought up during the meeting were the comprehensive plan through the city. We do have a couple of new middle schools that will be built here in the next couple of years, so potentially using HIA on those types of things, just to get give an idea to the public and the stakeholders of what those unintended health consequences could be that aren't foreseen currently. Within the workshop that we held today, we tried to give an overview to the community of what an HIA is, what the steps are, and what's some of the different domains that you can use it in. So we're conducting an HIA currently on the transportation system, but it has been used in school zoning sites, natural resource extraction, which might not work quite as well around here, but it does work in a very diverse policy setting. So we will hope to have the transit HIA done by the end of the year. We're going to hopefully set up a meeting with the city council, city managers, just to sort of go over it. It's going to be a little sort of general HIA of what the health impacts would be if transit were to be expanded. And then we hope next year to actually look at a potential funding mechanism. So if that happens to come up in any conversations in the near future or even next year, we'd like to do a more focused HIA on that particular policy and looking at the health impacts of that policy when it does arise.
We are currently pursuing funding from the Missouri Foundation for Health to further our work in HIAs, and we hope to find out about that in mid to late November. And if we receive that funding, it will allow us to pilot 1 or 2 additional HIAs to further learn about the process, for us to continue educating others within the community about health impact assessments, and then again continue to look at the potential sustainability of utilizing HIAs within Columbia and Boone County.